It is my privilege to be here tonight on behalf of the Canadian Nurses Association. And of course that is the association in Canada that represents 150,000 registered nurses, the largest group of healthcare professionals in Canada. So lovely to see our nursing history all brought together. And I feel as though, Megan, you sort of set the stage, and I'm almost taking us from that bridge into today and perhaps even into the future a bit. So, of course, as you well know by now, tonight we're here to commemorate and to celebrate the Rockwood Hospital, which opened up, as Megan said, in Kingston in 1888. And as we know now, was the first hospital school of nursing to focus on psychiatric care, or as we call it today, mental health nursing. So what a special place in history we've just seen that Rockwood has. And of course this history has special meaning to me because as I was introduced, I am still the Chief Nurse and VP at Ontario Shores Centre for Mental Health Sciences, so just up the road, I like to say. And Ontario Shores was just a bit behind Rockwood. We opened a few years after Rockwood, but we also established very quickly a School of Nursing in approximately 1919. And that School of Nursing, like Rockwood, had a 2-year program in mental health nursing, with the first nursing class graduating in 1921. And again, as we've just seen, Ontario Shores operated our nursing school, focused on mental health until 1972, at which time nursing courses moved to community colleges. So to all here today who are celebrating this 125th anniversary of the Rockwood Training School of Nursing, I say congratulations from your counterparts at Ontario Shores Centre for Mental Health Sciences and, of course, from the Canadian Nurses Association. I will just say one more personal note is that we recently had the opportunity at Ontario Shores to frame a whole number of our nursing graduation photos from all of those years, and we put them on a huge wall. And now no one goes by that wall without stopping and looking and saying, so just as some of you did with the 1971 photo. So it really is a very special thing to preserve our history, and to all here who do that, thank you for that special work. So the Canadian Nurses Association was established in 1908. So again, it has a huge number of 106 years of history of its own. And it exists for the purpose of cultivating and sustaining excellence in nursing, education and practice, research and policy making, and advocacy and innovation, and of course across Canada. And what we do is that through the power of the nursing profession, we work to improve health outcomes and to strengthen Canada's publicly funded, not-for-profit healthcare system. And sometimes I get asked, well, why are nurses so focused on this? Why is it nurses have taken up this cause, this mandate to care? And my answer is because there are so many of us. Although 150,000 RNs belong to CNA, given that we don't have Quebec in the mix and a number of Ontario nurses, there's really about 300,000 registered nurses in Canada. So we are a huge group, and that knowledge, that experience, that advocacy has to be put to work so that we can bring our voice to make things better. And that is really what's behind CNA. I'm wanting to share a little bit about what the Canadian Nurses Association is up to these days. And I might start then with the whole notion of history, which is what brings us here tonight, gathered in this special lecture. And we do have a real appreciation and a real dedication to preserving and promoting nursing history. In 2007, CNA published a position statement which affirms our belief that understanding nursing history is critical to participating in healthcare reform today. And again, Megan, you paved the way so beautifully with the last quote that you gave us. Learning from our nursing history is important so that we can advance the profession in the interest of the public. And we can see that the advancements in mental health nursing are front and foremost in tonight's lecture. I believe that these words from our position statement capture things wonderfully, and so I quote, "Nursing comprises diverse practices, roles, and identities that require ongoing historical inquiry to inform current changes in healthcare." And that position statement, even though in 2007, resonates today. At CNA, we really like to walk the talk when it comes to our view on preserving and promoting history. And ever since CNA was established in 1908, records have been carefully preserved. As you may know, in the year 2000, CNA signed a historic agreement with the Canadian Museum of Civilization, the Canadian War Museum, and the National Archives of Canada to establish a national nursing history collection. Some of you may have visited that exhibit when it was displayed in Ottawa at the Canadian Museum of Civilization. I certainly remember doing so twice and could have spent hours longer each time. And CNA continues to endorse and support the Museum of Healthcare here in Kingston. It is playing such an important role by providing context and perspective on nursing, on other healthcare disciplines, and on today's issues. So thank you for your efforts to preserve and celebrate the history of nursing and healthcare. And if you will allow me to provide just one more example, this picture is a touching moment for me from my first year as president of CNA. It stems from an event that started all the way back in 1965, when CNA's executive director at that time, Dr. Helen Musalem, wanted to preserve history for future generations. So she created a time capsule, and she placed it in an exterior brick wall of CNA House, which is of course located in Ottawa. The metal box held pieces from important CNA activities and milestones up to 1965. Now, it was always intended that that would be opened in 2015, but in 2012, 3 years before that intended date, CNA made arrangements to open the capsule to allow Dr. Musalem, who was then 97, to participate. We were honored to have her present, as she passed away only 2 months later. And this picture is from that very occasion. Dr. Musalem, as most of you know, had become one of the most compelling and influential figures in our country's nursing history, particularly associated with nursing education reform. And so, as you can see, I have learned at the feet of the master here at CNA House. So I'd like to now turn the page a little bit to CNA's current initiatives and to tell you about our connection with mental health nursing. One of those connections comes through our members. Our members, of course, include the provinces and territories, so our nursing associations and colleges, also the Canadian Nursing Students Association, which includes students from RNs, licensed practical nurses, or registered practical nurses, as they're called in Ontario, and also registered psychiatric nurses. And the Canadian Network of Nursing Specialties, that is the 21 different specialties of nursing in our country, such as OR nursing, community health nursing, and mental health nursing. And of course, we have a new member class that will come into effect late this year, the Family of Nursing, which consists of the independent nurse, those nurses who are not members of their provincial or territorial association, and nurse emeritus groups. And I'm happy to tell all of those of you who are retired that we don't call you retired nurses, we call you nurses emeritus. Now, doesn't that sound much nicer? Absolutely. Absolutely. So stay tuned to trying to link you all together a little more as we keep going. So a little bit more then about the Canadian Network of Nursing Specialties. So this network is currently comprised of 44 national nursing organizations from a wide range of nursing specialties. You might be interested to know that 2 of those organizations focus on the topic areas we are talking about today. There is the Canadian Association for Nursing History, Canadian Association for the History of Nursing, and the Canadian Federation of Mental Health Nurses. And some of you may be already members of these or others within our 44-sized network. And this slide, really, I love it because it shows you all of the logos of those 44 groups. And I can honestly tell you that those groups are the beating heart of CNA, because these are the nurses who come together voluntarily around their particular specialty. There's usually a journal involved, there are conferences, there are various activities, so they work hard to bring their specialty to life. Well, in terms of specialty areas of nursing, you might also know that CNA has a national certification program that offers RNs a chance to earn a national credential in one of 20 specialties. And one of those specialties is psychiatric and mental health nursing. Almost 2,000 RNs in Canada have chosen to become certified in psychiatric and mental health nursing. And what they do when they do that is they undergo a special program of study and they take a national exam. So I always salute their courage, and I also salute their dedication, because they're really trying to be the best they can be in that specialty of nursing. And I have to tell you that I am reasonably new to mental health nursing as a focus, having been at Ontario Shores 3 years now. But prior to coming there, I was certified in community health nursing, being a very old home care nurse. But the nurses of Ontario Shores have challenged me, when I finish my presidency later this, in fact in 6 weeks, to start studying for the mental health nursing credential. So stay tuned to see if Barb can actually do it next year. These groups have been key drivers in advancing mental health nursing by ensuring that the knowledge and practice competencies unique to mental health nursing are kept current and evidence-based. So going right back to those wonderful pictures we saw of those nurses who became professional nurses and concerned themselves with the best in advancing mental health sciences, that still happens today. As I mentioned, these nurses voluntarily choose to become certified in mental health practice, or indeed any of the other of the 20 specialties, as a sign of their dedication. And I'm very proud of that certification program and the nurses who've achieved their certification. From my perspective, they really are demonstrating a mandate to care. So a mandate to care, as I mentioned earlier, any discussion of nursing practice and public policy and nursing's mandate to care really has to look back to the beginning of history, and I can't do that without talking about our founder of modern nursing, Florence Nightingale. And this is one of my favorite quotes from Florence Nightingale, because it drives us ahead. It drives us to be the best we can be. And what she said is, were there none who were discontented with what they have, the world would never reach anything better. In other words, she's saying that that notion we have that it can be better is what drives us to make it better. And that, to me, is the essence of a mandate to care. As you well know, Florence Nightingale was formidable in training nurses to be professional nurses, to provide consistent, holistic, exemplary care. And in fact, of course, she wrote the book on it, and I bet most of you have studied it, Notes on Nursing. She didn't stop her efforts there, of course. Florence took a policy advocacy approach to fight for better conditions, first of all for the soldiers in Crimea, as we well know, and then for improvements in nursing across the globe. She, of course, steadfastly forged ahead with ideas and solutions for patient-focused care, way ahead of her time, of course, and for modernization of our nursing profession. Of course, these few words barely touch on her advocacy efforts, but it's a glimpse of a nurse who changed the face of our profession, just as some of our schools of nursing did. But of course, our profession's history is filled with examples of nurses who have understood the inherent political nature of nursing. Just a few weeks ago, a nurse shared with me through our campaign. We have an RN awareness campaign that you will soon see released. And she talked about advocating in her organization for policies around staffing and around access to care. So we are still doing it today. As providers of holistic, comprehensive care, registered nurses know that to be concerned with health is to be concerned with the social context. For example, how can an RN promote health without insisting on the basic health prerequisites for those in our care? Nurses advocate for health promotion by drawing attention to the social determinants of health. We know them so well as nurses: poverty, housing, education, nutrition, safety. And part of that advocacy is speaking up for improvements to access and the delivery of mental health care services in our country. Well, how do our nurses go about doing this? Well, a key way is through trying to influence and shape public policy. And this is perhaps the unique place that CNA can claim on behalf of nurses. We have created the infrastructure for nurses and the go-to place for government to consult on various policies and initiatives. So we believe that we have a strong role to play in shaping healthy public policy. In 2008, the International Council of Nurses said, and let me just remind us all that we were created, CNA was created in 1908, specifically so that Canada could join the International Council of Nurses and thus take its place in the global family of nursing. And ICN said, nurses have an important contribution to make in health services planning and decision-making, and in the development of appropriate and effective health policy. Nurses can and should contribute to public policy related to the preparation of health workers, care delivery systems, health care financing, ethics in healthcare, and determinants of health. And those words find their way into our CNA policy planning all the time. Of course, when we think about public policy, we're going one step further by focusing on healthy public policy. By that we mean policy that is characterized by explicit concern for health and equity and demonstrates accountability for the impacts on health. Healthy public policy incorporates a concern for population health and well-being. CNA has made a commitment to look at public policy issues through what we call an equity and social justice lens. In 2006, CNA published a policy document with a social justice gauge, in which social justice was defined as the fair distribution of society's benefits, responsibilities, and their consequences. It focuses on the relative position of one social group in relation to others in society, as well as on the root causes of disparities and what can be done to eliminate them. For CNA, there is a recognition of unresolved health disparity for our Aboriginal peoples, for our immigrants, and other vulnerable populations, such as our seniors. The social justice gauge is a lens to guide us, and others as well. CNA adapted the gauge in 2010 to make it more user-friendly so that it could be used beyond CNA's walls to support the assessment of policies, documents, and programs regarding their alignment with social justice. I was reminded of this afternoon when I took a very short walk in the heart of downtown and saw many of our homeless looking for handouts and needing help. So the social justice gauge is a lens to guide us and helps us to make these policies more user-friendly. But we embark on lots of other initiatives that examine nursing practice and how we might advance healthy public policy in Canada, and some of those are featured on this slide. So, for example, we submitted policy recommendations to the House of Commons Standing Committee on the Status of Women in 2011 to share our approaches to eliminating elder abuse. CNA recommended the federal government develop a national abuse prevention strategy that included targeted outreach programs anchored in public health services, supportive housing, and tax credits for seniors. Our efforts to influence policy in this area were rooted in an important aspect of nursing practice, the belief in providing for patient safety, and that includes, of course, eliminating elder abuse. Yet another example is our effort to influence public policy to ultimately improve Canada's health system through our, quote, Top 5 in 5 initiative. This past year, we brought together experts and stakeholders to come to consensus on 5 priority health status and system performance indicators that Canada should work towards. These would be clear and measurable and would advance nursing-sensitive outcomes. This particular work took place in response to the National Expert Commission in 2012 that gave us a recommendation for Canada to aim to rank in the top 5 nations on 5 key health status indicators. The 5 indicators are as follows. Increase the percentage of primary care practices offering after-hours care. How often do you have trouble getting in to see your physicians or your nurse practitioners, for that matter, after hours? So next, that's our first one. But I won't take the time to go all through them. You can see that they are available on our website. But what we need to do next is build that broader public consensus around adopting those 5 indicators. Another activity CNA undertook recently was bringing registered nurses' perspectives on enhancing scope of practice to the House of Commons Standing Committee this past April. In this case, we were looking at existing controls and limitations on nurses practicing to full scope. We recommended that the federal government create a table or venue through which various stakeholders could come to consensus on how to adjust legislation, professional regulatory frameworks, and standards of practice so that RNs can carry out continuous, consistent, and optimal autonomous nursing activities across this country. Why would we do this? Well, it's important to see how changes these regulatory and legislative areas have related to nursing practice might positively impact the cost effectiveness of our system. And of course, we all are committed to a sustainable, publicly funded system. Mental health has long been an area in which CNA has worked tirelessly to influence public policy. When we do so, we use a number of principles to guide us. These are a few of them. First, we believe that the mental health of individuals and communities is best supported by the cooperation between health, housing, social services, criminal justice, non-for-profit, and private sector partners. CNA recognizes that stigma lies at the root of discrimination related to mental illness. And in my tour today of this facility, stigma came up again in terms of both its effect on the patients that we look after, but also on those who serve those patients. We believe that all Canadians have a role to play in resolving this social injustice wherever people live, work, and play. In addition, we believe that access to mental health services in primary and community-based settings must be improved by supporting the development of policies, legislation, and funding mechanisms that facilitate timely and equitable access to mental health services. As an active member of the Canadian Alliance on Mental Illness and Mental Health, CNA has joined with mental health organizations to ensure that mental health is placed on the national agenda. The specialty nursing group I mentioned earlier, the Canadian Federation of Mental Health Nurses, is alongside us with this initiative. Through our groups, CNA has worked with several prominent mental health organizations to advocate for amendments to Bill C-54, the proposed Not Criminally Responsible Reform Act. These amendments would remove restrictions that limit access to mental health treatment and services. And we took our message to the Canadian Justice Minister with a letter stating the nursing profession's concerns about this act. Also, through our role on the Alliance, we met with the Treasury Board President, Tony Clement, to discuss ways of improving public sector policies related to promoting mental wellness in the workplace. We promote many great mental health initiatives, and CNA is pleased to have been involved in the development of a video that the Mental Health Alliance created to promote not only mental health awareness, but also increased access to mental health care. For our part, we wanted to ensure that the nursing voice was presented, and so CNA arranged for one of our members, and you see her here, nurse practitioner Tanya Dick of British Columbia, to speak about the nurse's role in mental health. Another area of focus has been mental wellness in the workplace. In 2013, CNA publicly committed to implementing the voluntary National Standard for Psychological Health and Safety in the Workplace. This standard, which was released by the Mental Health Commission of Canada in 2012, offers a set of guidelines, tools, and resources that promote employees' psychological health and prevent psychological harm due to workplace factors. As a first step in implementing the standard at CNA House, about 1 in 8 employees received what's called mental health first aid training by the Mental Health Commission of Canada. While this focus is certainly more internal to CNA, we've been focusing too on spreading the word about the standard outwardly. As one of the first national organizations to embrace the standard, CNA was invited to the Healthy Work Environments Institute, hosted by the Registered Nurses Association of Ontario. We spoke with nurses about how to promote the national standard in their own workplaces. Just another example of how CNA advocates for the adoption of healthy public policy. And I'm also proud that in my workplace of Ontario Shores, we have endorsed the standard and are moving ahead to implement. Well, due to CNA's strong relationships and credibility on mental health issues, we were invited last year to participate on the National Mental Health Advisory Committee for the Bell Let's Talk initiative for Clara's Big Ride. Many of you have heard now of Clara's Big Ride in the media. You know that she will finish it on July 1st in Ottawa. Olympian Clara Hughes is cycling right across the country to increase Canadians' awareness and acceptance of mental illness at home, school, and work. She started in Toronto on March 14th, has been to the East Coast, is currently in Northern Canada, and will cycle her way back to end the ride again in Ottawa on Canada Day. CNA is an active member of Bell's National Mental Health Advisory Committee, which is made up of 13 organizations focused on mental health and health care. Through our participation on this committee, CNA is working to build lasting awareness, acceptance, and action on mental health in Canada. This initiative represents an effective approach to influencing public policy, an intersectoral collaboration between private business, Bell, and the healthcare sector. Well, these are just a few pertinent examples of ongoing efforts to influence mental health policy. Others are on the horizon, and I encourage you to visit the mental health care section of our website for current activities. Well, it has truly been a pleasure for me to be here tonight. This event has allowed me to delve into areas that are very meaningful to me, both professionally and personally. We know that 1 in 5 Canadians, some even say 1 in 4 Canadians, will suffer from a mental health illness sometime in their careers, in their lives. So it is important for us to understand that. Before I come to a close, and thank you for acknowledging Nursing Week earlier, I would like to note that next week we will celebrate National Nursing Week. And that week is important because it affords us as individuals and as a collective profession the opportunity to celebrate our achievements, reflect on our profession, and look towards the future. So to each of you as nurses here tonight, and on behalf of CNA, I wish you all a happy National Nursing Week. Thank you again, and I understand we may have a few minutes for questions.